This one is going to be fun.
Yeah, I'm excited about this one, actually.
I was looking in Google for coming up with topics of what are women in their 40s talking about? And so this came up as there's two of them. So there's the top 10 that women over 40 talk about on Google, like the questions that they ask. And then there's the top 40 questions that women put into YouTube. Question number one on both Google and YouTube was, why are my periods so irregular?
I can't believe that, actually.
All I'm going to say to that is, hello, perimenopause, and that's why.
Okay.
This one, I would say, stop asking Dr. Google and go ask your OBGYN.
Yes.
So number 2 was early symptoms of bone density loss. And again, I'm going to read the definition, like what Google says, because it gives back answers. And so Nar and I were looking at these as we were getting ready to get started and go, oh my gosh, it didn't. So this one says when our bone protecting estrogen levels drop, which happens around menopause, we start to experience bone loss. So it's no wonder that countless conscientious women are looking for early warning signs. Unfortunately, according to the Mayo Clinic, there aren't a lot of detectable symptoms in the early stages of bone loss. It often isn't until our bones have been weakened by osteoporosis that we feel the effects, which is why we may want to target our searches around bone health toward prevention and rebuilding. I kind of agree with this, but you know why nobody is talking about osteoporosis? Because nobody really thinks about it or gives a crap about it until we hit our 50s.
Yes.
And then when you hit your 50s and then people hear about it, they're like, oh, crap. So I think maybe women in their 40s are starting to hear about bone loss and bone density. But most doctors aren't going to give you a bone density test until you're 50. So this is kind of an interesting question. But I think this is probably something that's been newer that's coming up that people are asking about bone density.
And honestly, you know how it talks about like prevention and rebuilding? Most of us don't Google something until it's kind of, not that it's too late, but it's actively happening.
Right.
So it's like, well, yeah, I'm going to Google osteoporosis when I'm like frail and falling apart. Sure. But then now I'm like, I'm still young and healthy and doing my thing. I'm not going to look up osteoporosis in ways of preventing it, because then I'm going to live in a life of anxiety constantly.
I think the best thing I would just say for our younger generations is just work out.
Your background is fitness and nutrition, right? So you were always very active, and obviously you had to be active to a certain point to get that body that you were working so hard for. So imagine if you hadn't even done that. Would your condition be even worse than it is if you hadn't done all that?
Probably.
Yeah, right?
Okay, you get number 3.
Does Botox hurt? So this is the answer. This is actually the first of a mile-long list of questions we have and often hear about Botox, but the short answer is yes, Botox hurts, though probably not that much. That's such a bullshit answer, I can't even tell you. So if you ask me, does Botox hurt? I'll tell you what hurts. Cesarean, that hurts. Breaking your finger, that hurts. Waxing hurts, like Botox doesn't hurt. But I think most people that come to my clinic, it's all about they mentally psych themselves out. So they're like, oh my God, all that. I'm like, will you all relax for a second? It doesn't really hurt. It's just like a pinch. You're literally having maybe half an inch of a needle, if that, just poke through the skin. And it's like, have you ever had a pimple on the border of your lip? And you try to pop it and your eyes tear up because you're like, oh crap. Kind of feels like that. Not as intense. And then it also just depends on your pain level, which I think boys are worse. The guys that come into my office and get Botox are big pussies. Dr. Google is a man, you guys. So yeah, no, I don't think it hurts. Honestly, it doesn't. There's worse you could do. What's up?
Number 4, causes of women's hair loss. Honestly, we've been wondering this ourselves ever since we noticed sad little clumps of our precious hair puddling up in the corners of our shower. The answers are just as freaking hilarious as possible. I think what a lot of people don't understand is that your hair grows in cycles. I don't think many people talk about, like, it has a growth phase and then it has a shedding phase, just like postpartum. Like, women will like freak out because the reason why your hair is so amazing while you're pregnant is you don't shed hair. And so then you shed hair.
Yeah.
But I would say today there's a lot of things. So women, it's really, they talk about when your estrogen progesterone starts to change in perimenopause, your hair will change. It just, the consistency of it, the texture of it is, when I was 40 and in the middle of perimenopause, that's when I decided to stop dyeing my hair. And my whole hair, like the gray, is a totally different texture. And I shed a lot of hair as it was changing, but it was basically...
Do you still shed?
Not as much as I used to shed.
Yeah.
But I'm now on the flip side of menopause. So I'm thinking that had a lot to do. My hormones now, I always tell people the great thing about menopause, your hormones are so stable. They're either flatlined, so you have no estrogen and progesterone really,
Yeah.
or you have estrogen and progesterone from having, you are getting hormone replacement therapy. So it's either or, but your hormones aren't fluctuating. But there's lots of fluctuating. Well, and then also, I think where we're probably seeing a lot of hair loss right now too is because of the GLPs too.
Exactly. I was just going to touch on that. So a lot of the women ask me about, so Nar, did you experience the hair loss? But I'm a little different because I did the GLPs right after pregnancy. So I wanted to shed the weight off immediately postpartum. So I didn't really know if the hair loss for me was the GLP-1 or was it the hormonal changes and then trying to get back to base. So I couldn't really tell you if from my experience if it was a GLP-1 or not. But that's not to say that I've had people tell me with the GLP-1s that they do lose some hair. And when you lose a lot of weight, especially rapidly, your hair is going to fall off. And you're at some sort of like nutrition deficit or calorie deficit. Your body's not getting the nutrients it needs or the way it normally does. So you're going to lose that hair. Your hair loss is probably, or you maintaining your hair is the last thing that your body's going to think about. Your vital organs are trying to survive and your hair is the last thing that's trying to survive, right? So that's why with the GLPs, it's extremely important for protein and water and the vitamins and supplements to take so that you can maintain not only your weight, but what's happening on the inside, including your hair. Deficit in calories and the nutrients, that's one of probably the two things that I'd say about the GLP-1s.
Anything with thyroids that can do the same thing. Mm-hmm. Okay, so number 5, Jennifer Aniston's beauty routine.
Oh, yeah.
And then the answer from Google goes, we've actually gone to great lengths to answer this question. You share with them what your thoughts are on this one.
Listen, I think Jennifer Aniston looks great. Do I think she's the most beautiful woman? I don't know. Everyone has their own opinion. But I think she's pretty healthy and somewhat natural, even though she's had some work done in the past. But that's not, okay. So I think her routine is working out, staying hydrated, using a ton of SPF. And I think those 3 are your pillars of looking young and having great skin and creating collagen and all that jazz. I always tell people, no matter how much Botox you do, how much fillers you do, I think if you don't take care of what's like the true foundation of skincare, you're going to look like crap anyway. Because you can look fantastic around your eyes, your forehead, and between the eyebrows. You might look so good, but everything else that's happening around the mouth, jowling, your neck, all of that is what really, or someone's hands, that really shows someone's age. They always say like, look at someone's neck and then you'll figure out how old they are. So I want to say SPF, a good skincare regimen, staying hydrated, protein.
I love it.
Everything is like cherry on top.
Okay. Help for hot flashes. So Google's response is hot flashes are part of a transitional period in menopause that typically starts between 45 to 50. Liars. Intrusive and uncomfortable as they are, it makes sense that we're flocking to find solutions. We've learned there are some lifestyle things that can help, from deep breathing to avoiding caffeine and alcohol. It's worth noting that while women in their 40s and 50s experience hot flashes to varying degrees, if you happen to be under 40 and having this symptom, it can be a sign of a medical issue that needs attention.
So, deep breathing, avoid caffeine and alcohol. The top 3 things I will not give up. Because I'm not giving up caffeine. I'm not giving up my alcohol. Let me tell you, deep breathing, when I'm pissed off, I'm like, I'm going to go off on something. I can't just be like, I just take it all in.
Deep breathing has never made a hot flash go away for me.
I've never even had a hot flash.
You're lucky.
No, I'm getting there.
But I think that's interesting that that's what it said. I will say, years ago when I was perimenopausal and going through the start of this, I did do a detox. Caused me to give up caffeine for 11 days. And it was brutal. And I think about the only time I ever nearly killed my husband, really, was when we were at a soccer tournament. And he's like, I'm going to go get some iced coffee. Do you want iced coffee?
What is it about coffee, though? Like, it's the best.
It's going to raise your blood pressure. It makes your heart beat a little faster.
Good.
So
Well,
if you're
little pep in
suffering
your
with
step.
a lot of hot flashes, but the thing is if you're really suffering from hot flashes, go find a doctor that you can talk to because they have hormonal issues, like hormonal drugs that you can take for hot flashes, but then they also have non-hormonal things for hot flashes. So there are different ones. And there's varying degrees of a hot flash. I will say this, if you work out regularly, when you're in the gym, for those of you that have no idea what a hot flash feels like, so this is what it's basically when you're in the gym and you're working out, you know that moment right before you're going to start sweating. And you just feel like that heat is just rising. And any second you're going to start sweating.
Yeah.
That's a hot flash. And it's not a normal, I would say, don't think that you're dying if you're in your early 40s and you have a hot flash.
Yeah.
You can have women can have them with their regular cycles. It's the varying degrees of your estrogen and progesterone. So you can have that in a normal cycle and everything is fine.
Yeah.
Okay, next one. Best CBD oils. And there's nothing. So that one is going to be, the reason why that one's in there is because of pain. Most people associate CBD oils with pain. Sleep, pain, CBD oils, natural. So that's what it's going to be. When I had a supplement store, we sold CBD oils in there.
Does it work?
So we had people with chronic issues that would come in and they would say that it definitely helped.
Yeah.
A lot of people use CBD oils for their pets, actually. So it can be used for them as well, too.
Oh.
So. Okay, you should answer this next one.
Oh, is brain fog for real? We assume so. What else could possibly explain why we had to read this question 3 times just to process? And once again, it can be frustrating part of menopause and perimenopause and menopause, as well as a symptom of certain debilitating medical conditions. Lately, it's gotten worse attention as a lingering effect of COVID. For us, it often comes hand in hand with chronic fatigue, and these are the only things that have helped with that. In short, there are a lot of reasons women in their 40s might experience brain fog, and if you're among them, it's worth talking to your doctor. We blame everything on COVID. But yes, brain fog is definitely for real. And I also think ADHD is a thing too, because and anxiety, like these are the things that I personally suffer from. Like I just can't. If I'm home, so my phone is away, I can't do patients, I can't see anyone, I can't do anything because at home is where my attention needs to be with the children and all that. I literally have to consciously tell myself, I cannot move to the next project from one counter to the next, from vacuuming to sweeping without finishing one before I go to the next one. So for example, when you and I talk and you text me something, you have to excuse me for texting you 1,000 times after that, telling you, where are we meeting? What time are we doing this? What did we say we're going? Did I say, like literally I had bought, my girlfriend just had a baby. So I bought her and her whole family their first holiday pajamas. Mind you, she texted the whole group saying, thank you guys for the gift and blah, blah, blah. I texted her weeks later saying, did you ever end up getting our gift? Like we had a full conversation about it, but I'm completely lost. It's fried. It's menopause. I don't know what it is.
Well, it's really good that you're good at your job and it just comes natural.
There you go. So yeah, brain fog is definitely a thing, at least for me. And it's horrible.
Okay, number 9, can I run with knee pain? Can we just pause to declare our deep admiration for the woman Googling this? We've personally had to turn to highly creative measures to get our sluggish, pain-free selves to complete any semblance of a workout. And here you are standing before a search engine asking is it okay, your aching knees for a run? We bow to you, if not for our own aching everything. I thought that one was hilarious. Find out why your knees hurt. That's the best thing. And, if you're a woman over 40 and your knees are aching and hurting, it's the changes. And we've mentioned that estrogen is in all your joints. So the estrogen is moving out of your knees. So I like to tell women as, being a personal trainer for the past 25 years, what's the knee pain like? Is it something where it's a stabbing knee pain? Is it just an aching knee pain? So it's looking at the differences between those. It could be the way you're lifting, the way you're changing things. Have you just started stuff? The other thing I tell women is, you can do like a speed walk and you can walk and get just as good of a workout than if you run. So what I find myself doing more so with women over 40 is pulling back their workouts and saying, just recently a new client came in and she's like, I lift 5 days a week and I go running three days a week. And I said, do you like running? No, but I need to do it to stay in shape. well, you're over 40. Things are changing now. We don't necessarily have to run. And if it's beating things up and things are hurting, then you shouldn't be doing it. So
I think running is very hard on the body.
it is very hard
It's
on the body.
constant like pounding on the floor. It can't be good. Swimming is fantastic. Yoga and Pilates are fantastic. Spin is good too.
It'll help with number 2.
What's
if we
number
go back,
2?
That was the bone density loss. So if you're a runner,
Yeah.
it'll help with that. But unless you have to really run for something.
So my husband's he's a great runner. He will not run for, let's say, 5 weeks because of an injury, and then he'll go for an 8-mile run just to see, let me see if I can get back into it again. 8 miles. I'm like, are you fucking kidding me right now? I can't even go up the stairs right now. And the reason I stopped running with him is because we would go on these nice runs down where we live, and he would be like shirt off, 6-pack, glistening, like a hot, sexy guy. I'm like beet red. I'm like panting like a maniac. Like, you don't talk to me. And I'm like a beached whale, like, dum, 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 dum. I'm like, who the hell wants to run? So I stopped running. I'm like, fuck this. I'm not doing this. Why am I doing this to myself?
Do number 10.
Whatever. Viagra. Viagra was okay.
Surprise, this is in there.
We can't say we know for sure what women over 40 are asking when they type in this singular term, but we suspect it has something to do with being the one in their household who handles all the ordering of all the things for all the people. Literally, we order everything in the family. We do it all. Have you seen that movie, My Big Fat Greek Wedding?
Uh-huh.
It says, the man's the head of the house, but the women are the neck. So, I mean, we're pulling all the strings here. So yeah, I mean, I order everything for the house. God forbid if I miss something on the list. You know I will not hear the end of it. But you didn't get this. But I just got 50 other things for you.
We now have a dry erase board that goes, it was the best thing I ever did as I put it in the kitchen, and there's a dry erase board. And I'm like, if it's not on there, you can't argue with me.
Yeah.
And so I was like, I have a system. I will erase it off the dry erase board when it goes onto the list on my phone.
Oh, because you'll get it done on your phone.
And then I take my phone with me and when I go grocery shopping or whatever, and I get the things off of there. But I'm like, unless it's up there.
Do you cook dinner or does your husband cook the dinner?
I cook all the dinners.
Do you do laundry
I do laundry too.
for everyone?
I do for laundry for everyone. I'm actually really
you
nice to my
iron?
kids. I do not iron.
For anyone?
No.
You know, my mom used to iron my dad's underwear. It was to that point.
Yes, people used to do that.
I'm like, will you stop? I think that's part of the reason why I don't, because she's got OCD over everything, or she used to. And so I grew up thinking that was normal to iron your husband's underwear, for fuck's sake. I'm like, I'm not doing that.
But these days they have like the cotton, like sport boxers or whatever. You know? Back
Listen,
then it
I'm
was-
not ironing shit. You iron your stuff or it's going to dry cleaning. I'm not ironing until I'm ready to go out and then I see it wrinkled, I will iron that one piece of shirt. That's it.
Yeah. Okay, we're going to now contrast this with some of YouTube's because YouTube had some different ones. So, how to stop my husband snoring without waking him up. I just kick him. I'm sorry.
Just suffocate him. It's fine. Put a pillow over.
My
I'm
husband,
just joking.
so
you
if
guys.
I can go to sleep before my husband, then the snoring is fine. But like last night, I woke up in the middle of the night and he's just snoring away peacefully. And I was like, oh. And so I'm just like, I kind of move. And then I kind of like push him in the back. And I'm like, okay, let's just see if this works. And he'll kind of grumble and kind of move. And I'm like, okay, I got a little bit of a break. So he'll roll over and I'll be okay.
If the snoring is really bad, I actually wake him up because I'm afraid of like sleep apnea or death or something. So I'm like, move, because you're like not breathing and you're like
Yes.
doing that thing. I'm like, can you just like, so I like literally shove him. Poor guy.
Number 5, look at number 5. Odds of getting pregnant at age 45.
I think it's a thing. Yeah, you can. Like, not that you can. I don't know what the odds are.
It's where most oopsie babies happen. Is during perimenopause because women think that, the skipping of periods. But I remember when I hit perimenopause, I can't tell you how many pregnancy tests. And I have so many of my clients being like, I've taken like so many pregnancy tests. I'm like, yeah, I promise you're probably not pregnant. It's just perimenopause. But, you still need to be careful because perimenopause is when those hormones are going crazy. So you can still ovulate and all of a sudden then you'll still have a period and you still have that potential of getting pregnant. So you have to be careful. Okay, number 7, cures for bloat. And I think that's because women, when the hormones start to change, your whole digestion changes.
Yeah.
Foods you used to eat no longer work anymore. And that's because, again, as I've mentioned, that your sex hormones are tied into your metabolism hormones. So your thyroid, your cortisol, your insulin, it ties all in together. So
I also think for someone like me, I have horrible, horrible IBS. You guys, I mean, if I tell you stories about my bowel movements, it's pretty scary. So the one thing that truly helped me was getting on the GLP-1. I don't remember the last time I was bloated. I mean, I used to bloat like as if I was 6 months pregnant. That's how bad it was. And then I would be distended and everything was uncomfortable, from wearing my pants to having intercourse to sitting. I would feel pressure on my rectum. I mean, that's how bad my IBS was. GLP-1s was a game changer for me because, first of all, you're not eating as much. Second, the stuff that you're eating that you're not really supposed to be eating off the GLP-1, I would eat. You know this about me, salami. I'm a sucker for salami and cheese and all that. But when I was on the GLP-1, no, I couldn't eat that stuff because it would make you feel icky. So it really, really was great.
and all I'm going to say with that is insulin.
Yeah. There you go.
Okay, so number 8, cost of microdermabrasion. You might want to explain to some people because I don't think everybody knows exactly what dermabrasion is.
So the microdermabrasion gets very, people confuse that with microneedling. So the microdermabrasion, on average, I want to say, depending on where you live, I want to say about like, I don't know, $150, if that. Microneedling is a little bit more expensive, but two different things. So the dermabrasion, basically you're sloughing off the dead cells and the first layer of your skin so that whatever product that you put on gets penetrated deep down on a cellular level. So you're basically, it's a good exfoliant using a hand, like a handheld machine that they use, like the tip of that pen or whatever, they scrape the dead cells off. That's the microdermabrasion. But the microneedling is fantastic. You get like 12 different modalities in one machine, whether it's fine lines and wrinkles, skin tightening, rosacea, pigmentation, two very different things. But yeah, so the cost of microdermabrasion is about $150 average.
Because microdermabrasion has been around a lot longer.
Yeah.
And now microneedling is something that's more
and it's not invasive at all. It's fantastic if you want to get like a good glow to your skin. It's quick turnaround. There's no downtime. It's good. It's good.
Okay, next one. Difference between a ruptured cyst and indigestion. You probably need to go to the ER.
Have you ever had a ruptured cyst?
No.
Okay, I have. While I was discharging a patient in the ER, it's like 2:00 in the morning, you guys. So the ruptured cyst is a lower abdomen pain. Indigestion is higher abdomen. So you're going to feel it like towards your breast, like breastbone, versus the cyst is all down there. And it feels like you're going to pass out from the pain. You're a little lethargic. Like you don't know what's happening and you're about to vomit everywhere. It's the worst pain. I don't wish it on anyone. Literally, I was discharging a patient. I hand him over the paperwork, and I sat on the chair and I said, I think I need to go pee. So I go to the bathroom and I'm like, do I have gas? Like so I'm like starting to just talk myself into like thinking it's something else. I come back and sit down on this table or on the chair and I passed out.
Ooh. Okay, number 10, what happened to my collagen?
Well, you lose it. It's a part of aging. And I think the studies show that you lose 1% of your collagen every year. So you start to lose it around 25 years old, or like mid-20s, you start to lose it. So, and then that's not even including your lifestyle. So if you smoke, you drink, you're under the sun a lot, you're adding on to that 1%. You're just praying for those fine lines and wrinkles and the...
Ah, goodness.
What's next?
Adult acne treatments.
I mean, you can chime in here if you have experience, but all I know about adult acne treatments is I think salicylic acid is fantastic, like topical that you put on. What's the other one? Salicylic acid and benzoyl peroxide is great. So what you don't want to happen is to have all those things of, let's say, your dead cells, your blackheads, your blemishes, all to accumulate. once it's there, it's hard to get rid of. But once you're like on a good regimen, once a month you do your facials, even if you do it at home, and a good skincare regimen at home every night, every morning, you shouldn't have too many problems unless it's hormonal. Then that's a different topic.
Well, and I will tell you, everyone that goes through my 21-day detox, especially the men, that's the number one thing they talk about.
Yeah.
Is their adult acne goes away.
They're just purging at that point. Let it all come out, because your skin, right? You have no other way of ridding your body of toxic stuff other than peeing, pooping, and your skin. What's coming out of your skin, right? You're sweating and all that stuff. So if you're detoxing, right, you're going to have to let it go somehow.
Yep.
Your skin is one of them.
Number 12 is the quickest ways to improve sex life. Well,
I think for me, it's more emotion based.
yeah.
I'm not one to have sex with someone or if I'm resenting you. I think sex life for me is more emotional. If we're on the same page, we're connecting on a deeper emotional level, then that's the best way to improve sex life.
Well, and I'm thinking, because this is what women over 40 are doing as a search engine, is the quickest ways to improve their sex life. It probably has a lot to do with their hormones.
Yeah.
So their hormones and everything is changing. And so sex doesn't feel as good as it used to feel.
Yeah.
You don't have the desire for it as much as you used to. And maybe because you are irritable and frustrated and yelling at your, significant other, I think that can probably definitely affect the sex life. They're probably wanting more sex and you're like, I don't want sex, like get away from me kind of thing. So I think understanding that, I would say if you are in the throes of perimenopause and, menopausal, I would talk to your doctor about it, because there's definitely things. If you're experiencing like it's super dry or it's painful or any of those things, that's definitely going to make it so you don't want to.
That's a good point. Yeah, totally.
I just understanding women over 40, I'm guessing it's all the changes that are going on and it's affecting so many things. But it could be relationship stuff too.
So I met someone recently. She mentioned she was 65 years old. She looked like she's maybe 50. She looked incredible. Her breasts were amazing. Like her body was voluptuous. It was just fantastic. She was so beautiful, just so beautiful. She was kind of like bragging about how she's sleeping with a man who's, I think, 30 something or 40 something. And I'm like, I'm sorry. And it wasn't about how do you get these men that are younger than you? That was not my question. My first thought was, how do you even want to have sex at 65 years old? Like, what is the sex drive to begin with? And she's literally just straight up said it. She goes, if you don't use it, you kind of lose it. She's like, dude, she's sleeping with men, half her age.
But research shows that the overall driving happiness hormone is oxytocin.
Yeah.
So, and women over, when you're post-menopause, if you orgasm, you're still going to release oxytocin. So you're still going to have all those really good feel-good hormones.
Yeah.
You don't have to have just estrogen to have an orgasm.
Yeah.
So, I mean, think about it. If she's probably got so much pleasure in her life, and it's probably keeping her young at heart and everything.
She's who I want to be when I'm 65.
Okay, so the next two, we've done Jennifer Aniston's beauty routine. We did Help for Hot Flashes. Stiff joints in the morning. That's definitely a process of getting older. I would say here with this one, use it or lose it. It's the same thing. I'm always telling people, you have to keep moving. You have got to keep moving. So if your joints are really stiff in the morning and you're having a really hard time getting moving, I would say, start slow with something that you can do to get that movement back in those joints, to get going with something. It doesn't mean, okay, I haven't been exercising, I haven't been doing everything. Okay, now I'm going to go out and do. People are like, I need to do a 60-minute walk. I'm like, how about we just get up and we do 5 minutes of some range of motion activity just to get moving through the body.
Yeah.
Those are going to be huge things. Again, the older we get, the more inflammation we have. Eating healthier is definitely going to help too.
And that goes back to, remember how we were talking about our holidays, and 1st of January comes and everyone's at the gym. It's like, you don't have to take that leap, this crazy membership.
I said, how about when your coffee is pouring, you do 3 sets of 10 squats. And then the next day you do 3 sets of push-ups on the counter. And then the next day you could do 3 sets of stepping back lunge or something like that. And she's like, well, that won't. I was like, that'll absolutely move the needle.
And if you have toddlers, you can literally pick them up and do do lunges and squats with them as your weight. And they'll love it too.
They'll
be
do
like,
it with
"Ooh."
you. Yeah. How to function on 3 hours of sleep. I never get 3 hours of sleep. Something tells me you do. So
I actually don't. So I was literally talking to my girlfriend about this. Ironically, men are by nature hunters. So they are okay with not sleeping and okay with 3 hours of sleep because they get to go into the wild. Women are meant to stay and nest and have the babies with them. So we need 8 hours of sleep. So no, I'm not. I need sleep.
I do too.
I can't do it.
So we'll go for these couple other ones. Are varicose veins genetic? Yes, they can definitely be genetic. My grandmother had them, so I had them. But for me, I almost feel like it skips a generation because nobody, like my dad and his siblings, nobody there had it. And then I don't notice anything in my girls. Is there anything I could have done different?
Probably not.
Not really, because I got it when I was younger. And I remember when I had the surgery done and everything. And I remember the doctor and my mom were talking. My mom was like, she shouldn't exercise. She really likes to exercise. And the doctor's like, no, that's really good for her because that'll actually pump the blood back up to the heart. So she should stay active and exercising. So
4 cups of coffee and health risks. Okay, I think there is a limit, yes, because you don't want your heart racing out of your chest and palpating. And the next thing you know, you're in some sort of like crazy tachycardic like state of mind or at risk. But 4 cups of coffee is a lot. It is a lot. Even for me, that's a lot. I think 2 is maybe okay, depending how big it is and depending on if you're adding all that shit to it, like your creamer and all the other stuff. I think it's just your heart rate increases, blood pressure increases. And the reason your blood pressure increases is because it's called vasoconstriction. So your vessels will constrict for your blood pressure to rise. So the more relaxed you are, you vasodilate, meaning your vessels are dilated, the blood pressure drops.
Okay, so number 19 says, why am I so tired on the weekends? Well, let's face it, your body's just trying to recuperate from everything that you've been doing all week.
Because I feel like during the week, you're trying to like do everything you can. On the weekend, then you're dedicating your time to family and your friends. So you don't rest. Yeah. Maybe we should just learn how to say no.
Okay, so let's look at number 22, flattering mom jeans.
Okay, the brand Madewell has amazing mom jeans. Good American. They have great mom jeans. I love it. It's flattering because no one wears skinny jeans anymore. And if you're wearing skinny jeans nowadays, stop wearing skinny jeans. It's not a thing. It's not a thing. Boot cut, flared, that's the jam. Like you want to be cool and trendy, get rid of the skinny jeans. No one's doing that.
But don't get rid of them. Hold on to them.
I mean, listen. Is not a thing anymore. You can get rid of it.
I know. I'm just going to say, if you spent $300 on your skinny jeans, hold on to them because they're going to come back. I have clothes, though, from 20 years ago because they're all back in style now. My kids would have loved them. So, but that's a segue. We're going to end this one on that one because we are coming back with our next one. It's going to be all about fashion, where you need somebody like Nar that knows stuff about fashion. And me, you know, the only thing right now that I'm like, okay, I'll spend like $100, $200 on that. It's leggings. It's, you know, it's workout stuff. So we're going to go into this where you've got somebody that's all about fashion and somebody that's so not about fashion.
Okay. I love it.